is my fourth speech, which is a persuasive speech. You guys are going to be persuaded today not to smoke cigarettes. Smoking is a practice in which a substance, most commonly tobacco, is burned and the smoke is tasted or inhaled. This is primarily practiced as a route of administration for recreational drug use, as combustion releases the active substance in drugs such as nicotine, which is highly addictive. It makes them available for absorption through the lungs. It can also be done as part of a rituals to induce trances and spiritual enlightenment. Smoke-containing nicotine is inhaled into the lungs, and the nicotine reaches your brain in just 6 seconds. Tobacco smoke contains more than 7,000 chemical compounds. More than 250 of these chemicals are known to be harmful, and at least 69 are known to cause cancer. The most common method of smoking today is through cigarettes, primarily industrially manufactured, also hand-rolled from loose tobacco and rolling paper. Other smoking implements include pipes, cigars, hookahs, and bongs. It has been suggested that smoking-related disease kills 1/2 of all long-term smokers, but these diseases may also be contracted by non-smokers. A 2007 report states that about 4.9 million people worldwide each year die as a result of smoking. There are nearly 4,000 chemicals in a cigarette. At least 43 of these ingredients are carcinogenic, which means that they're cancer-causing. Some of these ingredients include acetic acid, which is corrosive to the respiratory tract, acetone, which is used in nail polish removers, ammonia, which is used in floor and toilet cleaners, arsenic, which is a poison, hexamine, which is used in explosive chemicals, and many more. Smoking can cause many health risks that can be prevented just simply by not smoking. Ask yourself, do you want to live to see your kids and grandkids grow old, or would you like to be hooked to a machine for your whole life? Smoking is bad for your health. It harms nearly every organ in your body. Cigarette smoke causes 87% of lung cancer deaths. It is also responsible for many other cancer and health problems. These include lung disease, heart and blood vessel disease, strokes, and cataracts. Smoking also increases the risk of having cancer in the voice box, oral cavity, ovaries, pancreas, stomach, and bladder. Women who smoke have a greater chance of certain pregnancy problems or having a baby die from sudden infant death syndrome, which is also called SIDS. A baby can also be stillborn, premature, or even have low lung capacity. You are not only harming yourself, but also other human beings in this case. If you are regularly exposed to secondhand smoke, you can increase you and your baby's risk of developing lung cancer, heart disease, and emphysema. This is something that is not always taken as seriously as it should be. Your smoke is also bad for other people. They breathe in the smoke secondhand and can get many of the same problems as smokers do. Secondhand smoke, also known as environmental tobacco smoke, is a mixture of 2 forms of smoke that come from burning tobacco: side stream smoke and mainstream smoke. Side stream smoke is smoke from the lighted end of a cigarette, pipe, or cigar, and mainstream smoke is the smoke exhaled by a smoker. Side stream smoke has higher concentrations of cancer-causing agents than mainstream smoke, and it has smaller particles than mainstream smoke, which make it easy for the lungs and body cells to absorb. Non-smokers who breathe in secondhand smoke and nicotine and toxic chemicals by the same route as smokers do. The more secondhand smoke you breathe, the higher the level of these harmful chemicals in your body. All in all, smoking is a very dangerous decision and can hurt your future along with your body. It causes health risks not only to your body but to others around you. The best decision is to just avoid it or stop now. Quitting smoking can reduce the risk of these problems, and the earlier you quit, the greater their health benefit. Studies have shown that smokers who quit by the age of 30 reduce their chance of dying prematurely from smoking-related diseases by more than 90%. People who quit at the age of 50 reduce their risk of dying prematurely by 50% compared to those who continue to smoke. So ask yourself, do you want to be a victim of smoking?